How much radiation do I get from kidney cancer scans? Imagine you're keeping a close on your health after kidney cancer treatment. One common way doctors do this is through imaging scans, but how much radiation do these scans actually expose you to? That's a great question and one worth understanding. The most frequently used imaging test for kidney cancer follow-up is the computed tomography scan, or CORT scan. These scans use a form of ionizing radiation to create detailed pictures of your kidneys and surrounding areas. A typical CORT scan of the abdomen and pelvis, which is often used to check for any signs of cancer coming back, delivers about 10 to 20 millisieverts of radiation. If contrast dye is used to make the images clearer, the dose can be closer to 20 millisieverts. To put that in perspective, it's roughly equivalent to 3 to 7 years of natural background radiation, which in the United States averages about 3 millisieverts annually. So, one scan is like getting a few years' worth of natural radiation all at once. Other imaging options like standard X-rays or ultrasound involve much less radiation or none at all. For example, chest X-rays typically expose you to about 6 to 7 millisieverts, which is about 2 years of background radiation. Ultrasound, however, uses sound waves instead of radiation, making it a radiation-free option, though it might not give as detailed a picture of the kidneys. Now, if you're undergoing regular surveillance after treatment, you might have multiple scans over months or years. This can add up. Some studies show that patients who have repeated CORT scans for kidney cancer follow-up can accumulate doses exceeding 300 millisieverts over time. That's a significant amount of radiation, but it's important to remember that the primary goal of these scans is to catch any signs of recurrence early, which can be life-saving. While ionizing radiation does carry a small risk of increasing cancer chances, the doses used in diagnostic imaging are generally below 100 millisieverts. At these levels, the increased risk is considered to be very small or even theoretical. Most medical professionals agree that the benefits of detecting cancer recurrence early outweigh the tiny potential risk from radiation exposure. That's why doctors carefully justify each scan and try to optimize the radiation dose to keep it as low as possible without losing diagnostic accuracy. If you're concerned about radiation exposure, talk to your healthcare provider. Ask whether alternative imaging methods like magnetic resonance imaging or ultrasound could be suitable for your situation. These options can sometimes provide the necessary information without exposing you to radiation. Remember, every patient's case is different, and your doctor will tailor the surveillance plan to balance safety and effectiveness. In summary, each kidney cancer surveillance CORT scan typically exposes you to about 10 to 20 millisieverts of radiation. The total exposure over time can add up, especially with frequent scans, but the small risk of radiation-related harm is usually outweighed by the benefit of early detection. Always work with your healthcare team to ensure your imaging is necessary, justified, and optimized for your safety.